but after 2 minutes, on the picture on the right side, you get a crystal clear picture. So what was done? So there was a lot of air in the stomach. So we deflated the air and we played around with the knobs. And what we adjusted was the depth, gain, the time gain compensation and contrast to get that picture. The key to getting a good picture starts even before you put the probe. So when you hand ventilate during your induction of anesthesia, make sure that you don't push in air into the stomach. So try and keep the APL valve up at over 20. Be gentle when you ventilate. And if you feel that the stomach is distended, sometimes you may get patients with difficult airway, then make sure that you deflate it with an NG tube or a suction catheter. So when you switch on the machine, that's when your work starts. Your assistant can switch it on. It's very important to put the patient details, and it's extremely important to have the ECG cables, ECG. So you would have seen the previous speakers, all their images had ECG. So if you are writing the FIACTA exam or EACTA European exam, it's very important to have ECG in all the logbook cases you submit. It will help you to do the calculations better. Okay, so the first thing is the patient button. When you put the patient button, a page opens and you can click the new. So, and then you can add the patient details, where two important information are the indication and your name. This will help you to retrieve information at a later date when you have to go and present somewhere or when you have to get your good cases. If you put these two data, you can get information. There is an option to edit it also. So suppose you are doing a mitral valve repair, and at the end of the case you are developing SAM. So you can put SAM also there. So when you try to get cases of SAM at a later date, it's easy to retrieve that information. The next important thing is ECG. Either you can have the 5-lead ECG cable plugged in, or you can have a slave monitor from the machine. If you are using the slave monitor, you need to go to the physio and opt for the display auxiliary. Okay, then only it will show the slave. The next thing is the number of loops you need to acquire. So most of the machines have probably as one loop as the default. If you have one loop, it will just go click and then go back. Sometimes you may not get a good picture. So go to the acquisition and change to 4 loops. The disadvantage of storing 4 loops is your storage gets filled very fast. The transducers, they come in different sizes and frequencies. You need to understand that they are fragile and expensive. A good picture starts with a well cared for transducer. So if you drop the transducers, especially the transthoracic ones, you will damage it. So you have to look after your transducers really well. If you look at a bigger machine or a high-end machine, it will have options to have multiple transducer connected at the same time. So if you look at the sonosite machine, many of you may be familiar with the sonosite machine, you have an option of clicking on one button and selecting the transducer. So here similarly we have a button where you can actually click and select the probe. When the